So they are trying to make themselves comfortable. I will also speak from the point of view of a dentist.
Aditi? Hello and namaskar to all you lovely people. This is World Breastfeeding Week. Internationally, it is celebrated between 1st August and 7th August. World Breastfeeding Week this year has a theme and it is closing the gap. Aditi, we are live on YouTube with a podcast.
This is part one of a two-part series. This part is mainly intended for expecting and new moms.
We have viewers from North Karnataka, India, and outside India too. So I must say this. Hengidiri Ellaru, how are you all? Speaking of North Karnataka, we have with us Dr. Anuja Joshi, IBCLC. She is International Board Certified Lactation Consultant and she is the founder of Anandi Lactation Support Center, Hubli, first of its kind in North Karnataka. Let's put our hands together in welcoming Dr. Anuja Joshi. Welcome, Doctor. Aditi?
Hello,
Yes.
doctor. So, welcome formally to our podcast. Thank you for accepting our invitation. If you can maybe talk a little bit about yourself, your profession, and about Anandi also, that would be really great.
All right. Yes. Firstly, thank you very much, Ms. Aditi and Mr. Sujay. Thank you for a nice introduction. I am Dr. Anuja Joshi. I am a periodontist or a gum specialist practicing at Joshi's Dental and Maxillofacial Clinic in Hubli. Along with that, I'm also a lactation consultant. I did a basic lactation certification course about 3 years back because I was interested in it, and it was purely out of interest that I went ahead with it, which is also when I found Anandi Lactation Support in Hubli. It's a support center where we have mothers coming in with various breastfeeding challenges, starting from prenatal to during their phase of breastfeeding, weaning, starting solids, everything.
Thank you, doctor. So, we want to make this a little bit interactive. So, we thought we'll have some questions by us, some by our subscribers, and someone who wrote to us. So, maybe we can start with it.
Yes.
So, at what phase of, let's say pregnancy, like it's the earliest stage that we can think about. So, at what stage of pregnancy should a expecting mother start, preparing, mentally preparing, physically, ensuring her body is getting ready, doing the right things, so that her lactation journey is smoother, and probably when can they start to reach out to a lactation consultant also, like what would be the right approach here for an expecting mother?
Yes. So, see, anything that we do in life, when it is something that's quite a turning point or that's going to change things in future significantly, it does need some amount of preparation or homework from our side. Ideally, it's better if we do it. So, having a baby is a very important phase. It's a phase that's going to change your life forever in many ways and for the better. So why not get some basic knowledge and idea about general things that will improve your journey? It doesn't mean that you will not have your bad days. You still will have, but you will still be in a much better position to handle them, having the knowledge and not panicking or stressing over things, because you know if you're doing the right thing, if not now, later things will fall on track. So that's why it's essential that you do your homework. Also have realistic ideas about breastfeeding. So don't think of it as something that's going to be very smooth. There are not going to be any issues. It's quite easy. Everyone in the family has done it. So it is nothing like that. Everyone has their own challenges, and that's why when you talk about breastfeeding, you should probably a prenatal class is of help to the mother, because they at least expose the mother to what she's going to go through in the first week post delivery. You don't really make sense of day and night, nothing is on track that time. and you are also stressed about feeding the child when you feel that I don't have any milk supply. So it's not a very great situation to be in. So why not have a basic knowledge about it? And the best time, according to me, to get that done would be somewhere around the 8th month, because
Okay.
I feel doing it in the first or the second trimester is a little too early. By the time you actually reach that stage, you would have forgotten half the things. So if you've crossed your 8th month, and that is when you're looking at getting a prenatal class, that time your attention is on everything that is regarding the baby because you're so close to it. So you will have more queries, you will be thinking accordingly, and your attention will also be better. So that would be the right time to get a prenatal done. Along with that, health per se, have balanced meals, eat well, eat frequently, but also maintain an active lifestyle. So it is this when you do that actually helps in improving your milk supply when you're actually postpartum and only trying to consume foods that someone feels are going to help in your milk supply. It never really happens that way. So you
Mm.
have to have some, it has to start much earlier, and make sure you're getting all of that done. As you get closer to your delivery date, because you have knowledge about things, you will be calmer.
Yeah.
Get into the habit of doing something that you like. So engage some time in your hobbies or anything that makes you happy, because that will calm you down. And as you're closer to your due date, again have don't have very heavy meals. Have short meals more frequently. That will be more helpful. Also, foods that will give you more energy for a long time, because in labor you need energy for a long time, and not the energy kind of energy that you get through sweets. So accordingly, plan your meals and then go ahead with your, due date and delivery and all of that.
Yes. Are there any kinds of food that we should not eat? Because I
Mhm.
think there are certain, good diet for, expecting mothers. But is there something that we have to keep specifically in mind, keeping lactation and the next journey of breastfeeding? Like, is there something that they should not consume?
Okay, so now coming to foods, ideally, see all these foods that have been coming down traditionally in our families that eat this, it is good for, a lactating mother. Scientifically and research wise, there is no confirmation that yes, this does make a difference in milk supply. But having said that, because it has been believed to improve your milk supply and there have been generations following it, there must be some truth to it. And that is
Mm.
how we go ahead with. So there are certain foods which help in improving your milk supply, is what is said. I will tell you a little more about it a little later. In general, foods like jeera, ajwain, methi, badi sauf, oats, sabudana, dinka or antinundi, what they call,
Mm-hmm.
methi, sabasgi, garlic. All these are foods that are known to improve a mother's milk supply.
Okay.
However, a lactating mother ideally should be consuming alcohol for at least the first 2 to 3 months. If at all she wants to do it a little later, there are some guidelines, so she can follow that and not feed her child for the next 2 to 3 hours after consuming a glass of alcohol. So she could follow that, she could get in touch with the expert, and she will know how to go about it. Along with that, there are certain herbs, say mint or pudina, which sometimes drop your milk supply. So if there's
Okay.
anybody who's routinely eating those in their chutneys or food preparations, they could avoid it. Having
Mm.
said this, there is no significant research about it. And to talk about milk supply, keep in mind that all of these foods, or even shatavari is extremely good to improve one's milk supply. All of these have very limited effect on working on someone's milk supply. They just act as adjuvants to your milk supply. Milk supply primarily is based on demand and supply. So the more you empty your breast effectively, the more it refills. For anything to refill well and faster, it has to be emptied well. And that's the whole principle on which one's milk supply works. But what happens is we concentrate on everything else and not so much on this.
Right.
Right. So, regarding milk supply, so how does one consistently maintain that milk supply? Because I think some mothers are lucky enough to have enough milk supply as soon as the baby is born, but some may not have it due to whatever various reasons. We'll come to that. So, what can a mother do to, ensure it's initiated firstly and then maintained also?
So, breast milk supply and maintenance, the earlier you initiate or establish breastfeeding, the better it is in the long journey. So, how early? Ideally, the first feed should go into the baby's stomach within the first hour of birth.
Mm.
So that is when the first feed must go in. Now, usually what happens is most of the times in the first 1 or 2 hours, the baby is never with the mother for medical
Yeah.
reasons. And that's why babies almost always given top feeds or formula feeds, and the mother actually gets to see the baby much later. So she's lost a good 3 to 4 hours of not expressing her colostrum or giving it to her child. So make sure that even after delivery, if it is possible, then do try to feed your child as early as you can without worrying about the volume. Because for the first 3 days, the volume is not going to be great. It is thick called colostrum, which is rich in fats and extremely good for the baby. So that has to be given. And when you keep giving that every 1.5 or 2 hours frequently throughout the first 3 days, it is then that on day 4 or day 5, your milk starts coming in well. But when this initial stimulation it's not happened, and suddenly on day 5 or day 4, when you feel that now my breasts are feeling heavy and I have milk, and you sit to latch, you have to actually learn from holding the baby and getting the baby onto the breast. Okay, so that takes up another few days, and that puts you off track. So that's why it's always better to start early, and when you feel that you are not doing it right or you are unsure of what is happening, if is it happening correctly or no, then attempt to get the baby on the breast at every feed and then drain out your breast with your hands. Make
Mm.
sure that this milk is fed to your child through a spoon or a paladin, making sure that he gets mother's milk and your supply is maintained because you're constantly removing milk out. So when
Yeah.
you do that, every mother still has her own capacity. So
Mm.
maybe on day 7, there would be a mother who's making much more than what somebody else is. Here, there is also some medical health that comes into picture. Is it an IVF delivery? Does she have any thyroid issues? Is there any hypertension or diabetes that is involved? So all of these do play a role, and that may delay her milk coming in by a few more days. However, there is no mother who will never be able to feed her child. So the more we feed, the more body goes on making. I may
Mm.
not make 60 ml that somebody else is making, but it will still be enough. It will have the satiety that my child needs. And until then, you will have to cover up the gap with something else. And whatever that something else is, the aim should be that we gradually start weaning off our baby from that, trying to get the baby more on the breast. So, milk supply develops and builds very slowly. So, just give your body the time, keep getting the baby just to stimulate your breast. And then the body starts working on its own at their own pace. So, don't
Right.
compare.
Yeah, I think that's a very important message because, yeah, when mothers do tend to compare, or maybe they are compared by others. So, yeah.
Yes.
So you mentioned about colostrum, right? So this is just something which, when I was expecting, I used to, try to get as much information from the internet as possible. There, it used to be mentioned that, before the birth, there is something like golden liquid that someone can collect and store. I don't know if it's good to store, but is that something that's worthy of doing or exploring by expecting mothers before delivery?
So see, colostrum or mother's milk basically is called liquid gold.
Mm.
Whether you should be doing it before delivery. Now, usually there are studies which mention that when you stimulate the nipple, there is oxytocin released, the hormone, which can contract your uterus and give rise to premature labor.
Mm.
And we don't want that. So that's why too much of doing that before delivery is not recommended. All that you can try doing is maybe 2 or 3 days before your due date, because you know that you are almost there. So you could take a chance that way. So 2 days before your due date is fine, not for very long durations, not more than 3 times in a day, and maybe 5 to 6 minutes per phase, per session. So if you want, you could do that and try and remove a little bit of colostrum if at all there is anything coming. If
Okay.
not, then you will of course have to do it later. Also, you need to understand that milk actually starts coming in when the delivery happens and the levels of progesterone and prolactin fluctuate greatly. That is when the milk actually starts coming in. And when you
Okay.
are trying to do that before delivery, when the hormones have not really reached and fluctuated the way they should, you're trying to forcefully remove it, which may or may not be of great use. So
Okay.
personally, I would just say that stop, wait, and after delivery, do everything that you can to remove the cholesterol and give it to your child.
Being patient about it. I think that's good. So let's talk about maybe the storage. So how about mothers who might end up being away from the babies for any reason, like maybe the baby is in ICU, or the mother herself is probably physically recovering with due to some reasons. So how does that impact lactation? Because as you said, the initial hour is very important, but if that's not happening, so what can the mother do to ensure it's not hampered, as well as if it has already hampered, then what can she do, and if there is any storage that she can do, and how it should be done, what are the best practices?
Alright. So, if a mother for some reason is not able to feed her child directly in the beginning or whenever, then it is best that she expresses milk. If if the frequency of feeding has been say every 1 hour or every 2 hours, then that is when, leaving that gap, she should make sure that she is trying to drain out the breast from both sides. Preferred tool is hand expression. So making sure that she's trying to remove everything that is there, and that can be taken to the NICU and fed to the child by a sister there. So if
Okay.
she continues to do that throughout the day, ideally a newborn feeds anytime between 8 to 12 times in a day. So she should try to make sure that she's expressing milk that many times in a day at least, so that she is able to give her own milk to the child, and that will help her in improving her supply. So few days from now, when the baby is with her and she wants to feed, she may not feel that okay, my baby is coming and sucking but I don't have milk.
Right.
That should not happen, because she knows that she's been working on her supply even when the baby was not with her. If
Right.
there is a mother who's going to be doing it midway, not for a newborn but a little later, for some reason she's traveling, she's going away, or she's undergoing a surgery and she's not going to be able to feed her child, then she can start expressing her milk a little in advance. Based on that, can be told to her based on how much of milk she's making, so we can chart it out and we know how much of quantity is needed, so she can accordingly start expressing milk in advance, and she can store it. Usually, milk storage is to be done in small quantities, say 30 ml quantity would be ideal. And you do have storage containers or storage bags available. You could look up online. So, if you have those which are sterile and BPA free,
Mm-hmm.
so you can collect milk and store it in that.
Mm-hmm.
Usually, freshly expressed milk can be kept at room temperature for up to 4 hours. So she can use it anytime in the next 4 hours. If she's expressing now and she wants to use it later when she's not going out and somebody else can give it to the child. So that's okay. But if she wants to keep it for a longer time, then she needs to keep it in the refrigerator where she can keep it for a good 2 days,
Okay.
storing them and labeling them. She should mention the time and the date. Okay, and if she plans to keep it for longer, so when mothers go for work, they plan to resume work, so they are trying to just have a stash of milk which can be used later. So that can be kept in the deep fridge, and it can be stored there for a good 3 months, making
Oh.
sure that the conditions are good, sterile. She's doing everything in a hygienic condition, taking all the necessary precautions. Again, labeling everything. So she can keep it there. How can you give cold milk to your child? We can't. So you will have to remove it from the refrigerator, allow it to thaw, become, liquidy or come to room temperature. And in whatever container it is stored in, you could dip that container in a vessel with warm water so that the milk is at room temperature. Take a drop, check the temperature, smell it. If all is good, it can be offered to the child. Once the milk is brought to room temperature, you should not be storing it back. So you have to make sure that you finish it in the next 1 hour. So that's what the protocol is.
Okay, okay. So you also mentioned about the hand expression, like, the best way to do it. So are there any guidelines like how, like what the container should be like, or, how the mother should make sure her hands are clean and all of those things? So what are those basic two, three things that she should just, be ready with so that if she requires, she can do it?
Hand expression, you just need to have wash your hands thoroughly well, make sure that the breast is clean, and have a container. It could be a steel vati or silver container, sometimes silver bowl mothers take, but it has to be sterile. Of course, in hospitals everything is taken care of. They have bowls and containers which are sterile, so they don't need to worry about that in the hospital, and the sisters would help them in expressing milk. But once they are home, they need to take care of all this. I have seen mothers do all of this and then remove the vati with their hand and wipe it with a napkin. So when you do that, you are defeating the whole purpose of sterilizing the bowl. So once the bowl is sterilized, you should not be touching it with anything else, not even with your hands or fingers. Anything that is going to go in the baby's mouth, like the front part of the spoon, it should not be touched with our fingers. So these basic, hygiene and care that has to be looked into.
Okay. I think we have a question. Maybe I'll read it out here. So I'm a mother of 3 months old baby. Wanted to know if there's any table which says what is minimum time we need to feed a baby per session, especially for 3 months old. Like, is it 15 minutes? And for 4 months old, is it 20 minutes? So is there any time, like duration, which is the best suited for that age baby?
Yes, thank you for your question. There is no time that you're supposed to feed for any child actually. So, in fact, as the child becomes pro with breastfeeding and the older they get, their breastfeeding time starts reducing. So, if the mother has been feeding, taking almost half an hour to feed initially, and as the baby gets used to breastfeeding, and both of them are very well equipped with all of that, they know it very well, the feeding time usually starts reducing. And mothers wonder that he's hardly sucking for 5-7 minutes in and out. So, is that going to be enough? But yes, that is how it works. So, when you're taking too long to feed, you're taking hours to feed your child and still wondering that, my baby is still not getting full, make sure there is probably something wrong in the way you're doing it. Maybe the latch is not effective. Otherwise, breastfeeding doesn't take very long. So there is nothing like 15 minutes or 20 minutes for a 3-month old or a 4-month old. It should always be done on demand and for as long as the baby wants to. Breastfed babies rarely overfeed themselves, and they will leave the breast once they are full. And if they don't continue to leave the breast for hours together, that means they are not full. And then you need to look into different things that probably could be going wrong. The time actually, as per the books, to empty one side of the breast is not more than 8 minutes.
Okay. Okay. So if it's more, let's say it's probably taking half an hour in some cases. So does it mean that we are not producing enough?
Timeline is just for the books that 8 minutes it will take to empty and all of that. But if you feel that I'm feeding my child for a good half an hour, 40 minutes, feed for as long as you want to, unless it's getting exhausting. So when you feel that I'm just sitting the whole day feeding, or I'm feeding for a good 1.5 hour and the baby is not getting full, that is when you need to look into things. But if I'm feeding for a good 40-45 minutes, after which my baby is fine, seems satisfied, sleeps off, or is playful for a good 1.5 hour, then there is nothing to worry in that, and you could feed on demand whenever he wants to. Also, there will be phases called as cluster feeding, where the baby would want to feed more frequently. And you would have just said, and maybe in another 20 minutes, the baby may want to feed again. And that's the time when mothers wonder that, am I making less? Why is he just going on feeding like that? It's a phase because the body is going through growth spurt and he is going to be a little cranky that time. So don't worry about it. It's also your body's way to prepare you for the increased demand that's going to happen in future.
We have painful breastfeeding probably because of tongue tie. So, are there any such different factors that influence a mother's, breastfeeding experience, and so that just they are mentally prepared to be aware of it and get it diagnosed also at the right time?
So yes, tongue tie has it's quite a thing these days now. It was there earlier also, but just that now mothers are more aware about it. Now, what is a tongue tie? If you lift your tongue and you see there's a small band of tissue that's attaching your tongue and the floor of the mouth. Now, because our tongue is free, although it is attached, the movement is still free. And I can easily remove my tongue out and cross it beyond my lower lip. When that band of tissue is a little thick and tight, the fibers are short and thick, the child is not able to extend the tongue freely, even in lateral or side to side movements and even outside, tossing the lower teeth or the lower lip. And that's when his tongue movement is restricted. Now, in correct breastfeeding, if this is the breast, the baby's tongue is somewhere here. It pushes onto the breast and milk is expressed or removed out from the breast. But when the tongue is not able to extend properly, the tongue just keeps flapping here and irritating the nipple here, causing soreness of nipple and pain and ineffective breastfeeding. So generally, all babies have a tongue tie. Everyone's tongues are tied, and that's why every tongue tie need not require release. So if you feel that there is a tongue tie, you should get it checked from somebody who has enough knowledge about it, ideally a dentist or a pediatric dentist, or a lactation consultant. Having said that, the treatment to that would be releasing the tie and allowing the tongue to move freely, which is a procedure done either surgically or through lasers. But should we be immediately jumping onto that? No. Even in a patient or a baby who has a significant tongue tie, and if the breastfeeding is going fine, mother has no issue with an improved latch, there is effective breastfeeding and pain-free breastfeeding, then it may not require a surgical intervention at that stage.
Okay, so and there's also like inverted nipple, flat nipple. So we hear that it's not ideal for breastfeeding. So can you tell us about that?
So, see, the nipple is usually it is a little long and well-rounded and projected, which is more like a normal nipple. When the nipple is slightly flat and in level with the areola, you can say that it's a short nipple or a flat nipple. And a nipple which is inverted is actually inside. And even after stimulating it and pulling it outside, it still goes inside. So inverted nipple is a challenge sometimes in breastfeeding, and it does need some amount of guidance and practice. It takes time. But with regards to a short nipple, sometimes it may not be as difficult as it's made to be. So also I would suggest that when you all are going for your gynecological visits during your 9 months of pregnancy, you should ideally be asking and talking to your gynecologist, asking them to examine the breast whether you have any flat nipples or inverted nipples. Because it should not come as a shock to you after delivery when you are told that no, you have flat nipples, so you can't feed your baby. So that really stresses the mother a lot, and she has no idea of what a flat nipple is. So keep in mind that nipple does not really play, it does have a role in breastfeeding, but it plays a little less or a secondary role in breastfeeding compared to the breast. So it's not the primary thing for you to have effective breastfeeding. Even with an flat nipple, if you are taught how to hold the nipple, how to position the nipple and breast, you will still be able to breastfeed well with correct guidance.
Okay. And if, let's say, an expecting mother discovers it during her visits, so is there anything she can do about it, or just be mentally prepared and learn the right techniques? Like, what can she do at that stage?
Yeah, so while she's expecting and not delivered, it's not ideal to try to stimulate the nipple or pull it out like an exercise. Like I told you, we don't want premature labor. So that has to be delayed, and she could do it only maybe a day or two before her delivery, which is not going to help in a big way. But later on, after delivery, as the baby breastfeeds more often, the nipple length sometimes starts improving. Pumping, breast pumps do help in improving the length of the nipple over time. There is something called as a nipple puller, which the mothers usually creates a vacuum and pulls out the nipple. But in my personal experience, it's very momentary, and within a few seconds, the nipple goes inside again. So it doesn't help too much. But what has made a difference over time is probably pumping. That has improved the length of the nipple.
More now onto the working mothers. So usually, like in India especially, we have 6 months of approved, like, paid leave. Maternity leave is usually for 6 months unless it varies in exceptional cases. So usually after these 6 months, the mother is expected to visit office, go to office, even though with flexibility they have to go. So in that case, surely, expressing and storing is an option. But how to manage the whole mental stress around it? So what can she do to ease her mental health, be easy on herself, and not be worried about the quantity and stuff like that? So what can she do best from her side?
So when she's looking at resuming work, she should be very clear in her mind at for how long is she planning to or looking at breastfeeding, because that will take demand the steps that need to be taken now at this stage. If she's wanting to breastfeed exclusively, even beyond that, whatever feeds along with starting solids are given have to be entirely her milk, then she has to start expressing and having the stock of her milk much earlier, which will be planned, and accordingly she can start doing it. If there are mothers who are okay with, when they are away, I don't mind if any other milk or formula is fed to my child, and when I am at home, I will breastfeed my child. So she has to first be clear of what she is planning to do and what is she wanting. Accordingly, the plans will start falling in place. And this plan of hers, or this whatever her idea is of how long to breastfeed, has to be conveyed to her spouse and also to the other family members. If she's okay with giving a formula to her child, then that has to be told to the other members of the family so that they don't make a fuss over it. Because ultimately, it's the mother's decision. She's making her own choices, keeping everyone's health and needs in mind, her own and her child. If she's wanting to go out and express and feel, that also should not be made into a huge thing. And the necessary kind of support, even at workplaces, should be offered to her. So half an hour of gap she may need twice, while she's at work, to at least pump some milk. So that much of space and provision has to be given even at workplaces. If she knows what her plan is, then accordingly she has to start talking about it and conveying it to everyone in the family, to her friends, while they are talking about work and resuming work, so that it also spreads at her workplace. And when she goes and suddenly one fine day she goes and gets a pump and goes inside to pump, there are not many people. You don't want too many people staring at you. What's wrong with you? Come on, your child is now 6 months. You don't want those reactions because you know what you're doing and you're okay with what you're doing. So try conveying that to people. If they understand, it's well and good. If they don't, even then you will still stick to your plans, but you will be mentally prepared about it.
Right. I think for the mother, that phase is very challenging because she's already guilty herself for having to leave her baby at home and concentrate on her career and her work. and having clarity herself and being confident about her decision on how she wants to continue, like, with mixed feeding or exclusive or whatever it is. I think that clarity is going to help her a lot. And I think, yeah, talking more about it might also help, because I have seen firsthand that mothers are guilt tripped, like,
Yeah.
oh, you're not breastfeeding, oh, like including some pediatric visits, like there's a lot of guilt tripping going on, like 2 years you were supposed to do it and things like that. So yeah, I mean, I feel that gap should be closed, and one should also start thinking in a more practical sense of what is practical for the mother at that stage. So coming to that, like the 2 years, right? 2 years you should breastfeed, that's the standard. I think it's mentioned everywhere. But what is the next best realistic timeline for a mother to aim at, considering work, or even if she is not working? What is the next best timeline that she can at least thinking, okay, this is probably possible. If not 2 years, then maybe this I'll try to do.
Yeah, so see, even after we resume, the mother resumes work and then continuing to express milk or pump, it's not very easy. It's quite stressful. It adds a lot of work in her already busy schedule. So she has to manage that well, and it can get exhausting. So it's not very easy for her to do all of that, and she has to plan her journey accordingly, and that's where she also needs support. There are mothers who sometimes do it, and there are also mothers who feel that I have tried to feed my child for a good 6 months, and now I will go a little easy. So when I'm away, I'm okay with something else being given. And when I'm back at home, I will feed my child, demand feed whenever during the night and until the time I'm at home, which is the next best and the next practical option for many mothers. Although I have seen a lot of mothers, even in the guidelines, if you see 2 months of continued breastfeeding, by 2 years, sorry, by that they mean that even after 6 months and even after your baby is consuming 3 or 4 solid meals a day, at least try to give your own milk once or twice in a day. Could be before nap times, could be before the night sleep, but make sure that some milk is continued to be being fed to your child at least in 2 years. It's mainly for the immunity also. If that 2 year mark seems a little tough to reach, the next best option that IAP suggests is at least in 1 year. So make sure that you are trying to give your child your own milk until 1 year, and then gradually start off with the entirely weaning process. It should take a couple of months. It doesn't happen overnight. So in the long run, you end up feeding a good over a year. So these would be the next best options for the mother to go ahead with if she feels that pumping at work is difficult, or having the 2 year mark is difficult reaching that.
One question is, like, is there a time period during the, especially the first few let's say take 9 months, is there a phase when the supply, breast milk supply automatically starts reducing due to certain physical bodily factors of the mother? Like, is there like a time duration when this happens, which month and all of that?
No, not really. If you are continuously breastfeeding from the beginning, the body continues to make milk. In fact, milk supply improves with the next pregnancy. So there is no time frame where in this month you can see a drop. However, when the mother resumes her monthly periods, she does sense a little bit of a drop in her. She could sense a little bit of a drop in her milk supply, but all that she needs to do is continue with her schedule of pumping, expressing, feeding, whatever it is. And over a few days, she will see that the fluctuation has just gone off and she's back at her supply. So she needs to take care of that. The longer you feed, the more you delay your periods from resuming. The mother who has not breastfed, or who's breastfed for a very short time, she may have her periods coming in very soon. So that's the only thing where you have a little bit of fluctuation. I would want to say that keep in mind that if you have, while you're feeding your child, if you have pain while feeding, and so many times we are told that it's okay, you're doing something new in the beginning, you will have pain while feeding, then no, it is not right. If you're doing breastfeeding correctly, you should not be having pain. So if you are in pain, because when the mother is in pain, she's not going to be able to do it for very long. And as a human being, I can't expect somebody to go on doing something when she's telling you that she's in pain. It's wrong on our part. So breastfeeding done correctly does not pain, and if you have pain while breastfeeding, there has to be something wrong in the way you're doing it, and do seek help in such a case.
So, is there any right way of feeding, like position or something that the mother should follow for her comfort as well as the baby's?
Yes, I could just show you the most common position that I have seen mothers do. So, if this is the baby, usually the baby is here and they are feeding the child like this. Now, keep in mind that the baby, even when we eat or drink, we don't eat or drink like this, we face our food. So, while you're nursing your child or breastfeeding, the baby must always be turned towards you. There has to be a good tummy to tummy contact, and don't uh, your child like this. Second most common thing that I see here is the baby is always wrapped while feeding. We call it swaddling. So open up that dupti or wrap, whatever it is. While feeding, don't restrict the child, because when I'm positioning my child in a certain way, my baby may want to bring his hands closer on the breast. They will bend their legs. They will push out their bum, jut it out. So they are trying to make themselves comfortable. We can't be tied stiff like this and expect to drink comfortably. So, don't do these things. Thirdly, don't try to pinch the breast or the nipple and try to put it in the baby's mouth, bending down and sitting like this. Sit comfortably and never feed without a pillow. So make sure that you have a good cushion or a pillow support on your lap. Now, most of the times the pillows are like this. That
Hmm.
doesn't really help. So the pillow should be such that when I keep the baby on the pillow, my baby is at the level of my breast, and I don't bend down in any way to reach my child, so that I don't land up in backache a month from now. So keep
Hmm.
these things in mind and make sure that it's not just the nipple but a good part of the breast that is going into the baby's mouth, for which you need to face the baby towards you and try to get the nipple on the upper lip and lift the baby slightly to get the baby on the breast. Don't push the breast inside the baby's mouth. Also know that it does need some amount of practice. It's not that we teach or you saw some video and will get it overnight. It doesn't happen like that. Mothers need a good 3 to 4 weeks to actually learn the latch right. So it needs practice. It's a learned skill. Take your time, but learn it right so that you will be able to do it for a longer time. Even if it is a mixed feed, you will still be able to continue at least with 1 to 2 feeds for as long as you wish to. Apart from you knowing that there is nothing better nutrition wise for your child at that particular age, nutrition wise, there is nothing better than mother's milk for the child. And that is why, if you have a look at the formulas, they have groups of 3 months, 3 to 6 months, because they keep changing their nutritional value accordingly. With mother's milk constantly changes. It's not the same what it was on day one and what it's going to be at month two or month four. When I latch my baby and breastfeed my child, my baby's saliva enters my body, and that is what the body senses and adjusts the nutritional component of the milk accordingly. So there is nothing more beneficial for the child, of course. Apart from that, immunity is one thing that the child heavily relies on from this milk, which is lacking. We have not been able to create that artificial formulas. So mother's milk definitely has immunity which nothing else can give her, give the baby. Immunity to fight little infections, especially the upper respiratory tract and digestive infections, which the baby frequently falls sick with, and that immunity he gets from the mother's milk. Apart from that, of course, it's a very natural way of contraception. Till the time you're breastfeeding, you're unlikely to, conceive and get pregnant again. also for the mother, it's definite risk reduction for breast cancer, ovarian cancer, cervical cancer. And
Right.
that depends on how long you breastfeed. So because I have exclusively breastfed my child for 6 months, or I have breastfed my child for 6 months, yes, my risk is reduced. But the longer I feed, that will actually bring down the risk. So that's important. Mother's milk has a hormone for satiety, leptin. That's why if you see a breastfed baby is not obese or extremely fat, they don't look very chubby. They are on the leaner side. Although nutritionally they are optimum because they don't overfeed themselves. They know when to stop, which is usually doesn't happen in bottle fed babies. Okay, because they end up consuming a lot more and a lot faster than what they get from the breast. Every time the mother breastfeeds, she releases a hormone called oxytocin, which helps in the natural contraction of uterus, bringing back her expanded uterus because she's not going to be getting into extreme physical activity in the beginning, and that is what will help her actually to get back into her shape while she's still breastfeeding her child without having to do any diet restrictions and all of that. So breastfeeding has immense benefits. There is no doubt about it. I will also speak from the point of view of a dentist because dental treatment cannot be done in the first 3 months and the last 3 months. The fourth, fifth, and sixth months are considered safe for any dental treatment. So when you are looking at conceiving, that should also be in your mind that let's get everything sorted. Or if you have not been able to do that, then in your second trimester, do visit your dentist and make sure that every little thing is handled because we don't want mothers to come in the third trimester just 2 weeks before their delivery with a swelling where we are not able to do much. So that's why preparing begins not just in terms of that, but in many aspects of the mother.
What is the right time to approach Anandi Lactation Support Group?
And what are the ways, like, how to come to you?
Mothers usually come to me with problems. So they are well into 2 weeks or 3 weeks postpartum, and that's when they approach because they are facing difficulties. I would say eighth month or seventh and a half, eighth month ideally would be a better time, and
Okay.
because we do offer follow up support after the baby's birth, so that
Right.
would be a better time to get your knowledge and then take guidance once the baby is in your hand. Also, if you're struggling with breastfeeding and not sure of whether baby is getting milk, is it enough or no, don't wait for too long. Don't wait for a month and then come because we have lost out on an important month then. So in that case, reach out within a week's time or 8-10 days so that things can be sorted faster. The smaller the baby, it's easier for the baby, to make him used to certain things. When the mother comes to me when her child is 3 months old, and she has not been able to feed the child for 3 months, direct breastfeeding. And now she wants to get the baby on the breast. It becomes quite difficult. Not little, but quite difficult because it's a big baby and they are used to a certain way of feeding for 3 months. So you have to start from the beginning, right from building a rapport and making the baby familiar to the breast, knowing that, okay, this is also a place from where I get milk. So the challenge seems a lot bigger in that case. That's why start off early.
Is it that they have to visit you at the center in Hubli, or are there different ways to approach you?
Yeah.
So usually I am here at the Hubli Center, but I do take consults and prenatal and also during the post pregnancy, whatever challenges are there. These are also done online through video consult. So there have been many mothers. We have improved and got the mothers to feed only through video consults who are nowhere here, nowhere close to Hubli Dharwad. Of course, those need a little bit of patience and they are more time consuming. But I have seen over time, whether it's an online consult or offline consult, what really makes the difference is the mother and her attitude towards things and how calm she is, how realistic she is in her approach. Then, with that, whatever decision she makes, she still is a winner. So that really is what makes the difference. But I am available for online and offline consults at Anandi. Our numbers are there on our Instagram page. Or if they drop us a message on Instagram, we always get that. And that's their way to connect with us. I also do home consultations and home visits. So the choice is theirs whether they want a home visit or they want to visit us or opt for a video consult, online consult.
Okay.
Okay. In case a mother requests, like home consultation is one thing, but hospital consultation, do you also take up that during those
Yes, I
first few
also
days?
take that up. I do go to hospitals for hospital consultation, but my the criteria is that the hospital administration should be aware that I am visiting. I
Okay.
cannot go only based on the parents' call because
Mm-hmm.
I am entering a facility which does not belong to me, and the hospital must have an idea about it. So if they are okay with it, then I am okay.
So it
Otherwise,
should
I
be
don't
an
have to go.
official visit and not like a personal visit. Okay.
Yes.
I think we
Yeah.
have covered good enough points. Doctor, do you have any closing notes for this podcast?
Yes, firstly, it was a very nice concept that both of you came up with, and you all have almost covered everything that is important, even not for parents. Even if there's somebody else who's listening to it, this knowledge is not going to be a waste.
Yes.
Absolutely, doctor.
Yes.
Absolutely.
So I think this is very, very good information to get within just this, duration. And yeah, thank you for making time for us.
As Aditi said, this 1 hour very productive, very educational, and it'll help lot of mothers and fathers to take decisions, to take care of their children, come whatever situation.
And do subscribe to their channel, Sujay Jalwadi channel. I have, and so you must.
Thank you so much, doctor. And this particular podcast, which was live on YouTube on 3rd August, I will again reiterate, August 1st to August 7th is World Breastfeeding Week. So all three of us will do a big thumbs up to World Breastfeeding Week. Once again, Dr. Anuja Joshi, thank you so much.
Thank you.
Thank you so much, both of you. Thank
Thank
you.
you.
Bye.
Bye bye.
This was part 1 of the Q&A. Do check out part 2 where we address new dad, their family and workplaces.